Good afternoon, everyone. Bonjour à tous et à toutes. Thank you for joining us. Merci d'être parmi nous aujourd'hui. We are here today to provide an update on the City of Ottawa's response to the COVID-19 pandemic. Nous sommes ici aujourd'hui pour vous fournir une mise à jour sur les mesures prises par la Ville d'Ottawa pour faire face à la pandémie de COVID-19. My name is Kina Leclerc and I will be your moderator. Je m'appelle Kina Leclerc et je serai l'animatrice de cette séance. Before we begin, a reminder to place your microphone on mute until I invite you to ask your question. Avant de commencer, j'aimerais vous rappeler de désactiver votre microphone jusqu'à ce que je vous invite à poser votre question. Today, we will be hearing remarks from Mayor le Maire Jim Watson, followed by Councilor Eglai, Chair, Ottawa Public Health Board, le conseiller Keith Eglai, président du Conseil de santé d'Ottawa, la docteure Vera Etches, Chief Medical Officer of Health, médecin-chef en santé publique, and Anthony DiMonte, General Manager of Emergency and Protective Services, Directeur général des services de protection et d'urgence. After we hear from the panelists, we will take questions from the media. We will now begin with remarks by Mayor Jim Watson. Mayor, I will make sure that you're unmuted. Just one moment. But we can hear you now.
Well, thank you very much, ladies and gentlemen. Bonjour, mesdames et messieurs, et merci d'accepter notre invitation cet après-midi. Our vaccine rollout has made incredible progress over the last few weeks. La distribution des vaccins accélérée à chaque jour ici à Ottawa. On Monday alone, more than 120,000 appointments were booked, excuse me, and every day we vaccinate enough people to fill the Canadian Tire Centre for a hockey game. To date, we have administered more than 1 million doses of COVID-19 vaccines in Ottawa, and we should be very proud of the great work our public health and paramedic teams have done over the last several months, over the last year and a half, really. Just yesterday, we surpassed 35% of residents 18 and over have received both of their doses. Following this media availability, I have to do an event in Canada, and then I'll be going to the CTC to get my second dose this afternoon. And all of this speaks to a community where vaccine hesitancy is low and enthusiasm to achieve community immunity is very high. It means residents want the vaccine, and the teamwork of the City of Ottawa, Ottawa Public Health, the Ottawa hospitals, and several other community partners is successfully delivering those vaccines. Throughout the rollout of the vaccines, I'm reminded of what Anthony DiMonte has said, quote, "The province just needs to give us the vaccines and we'll get them in the arms," end quote. We have finally been getting stable, large shipments of vaccines. I thank the Premier for responding to our request for those additional vaccines a week and a half ago. It made a big difference in getting shots into arms. Now, back in March, when we marked the first year anniversary of the pandemic, I wrote an op-ed in the Ottawa Citizen that talked about how important and impactful municipal government and services are. Residents are seeing firsthand when they visit a pop-up or community vaccine clinic, the tremendous impact this municipality is having on bringing about a return to normalcy as soon as possible. Now, speaking of a return to normalcy, there is more optimism among the business community. Aujourd'hui, nous entamons la deuxième phase de réouverture dont nos entreprises locales pourront enfin ouvrir leurs portes et augmenter leur capacité. For instance, this morning I visited my local barber shop on Wellington and got a haircut for the first time in many, many months, and I know lots of people are doing that themselves as well today. Now, not all businesses are open yet, and a few good days don't make up for months of hardship for business owners, but it's nice to move a little closer to being back to normal. Je veux surtout remercier les propriétaires de nos commerces locaux pour leur incroyable persévérance depuis plus de 15 mois et leur dévouement continu à notre communauté. My hope is that we can use the summer break to recharge, replenish, and rejuvenate, to put this year in the past and get kids back into school in the fall. What we can do for students and for businesses to make sure we continue to follow the public health guidelines, and let's continue to get our first and second doses of COVID-19. Bottom line is we are still in a pandemic. Pour conclure, je souhaite à tous une joyeuse fête du Canada. Restez sécuritaires. This Canada Day, all city-run events have been canceled due to COVID-19 restrictions. And while I look forward to an opportunity to celebrate our country with many residents next year, Now more than ever, it's most appropriate that we take the time to work towards meaningful reconciliation with all partners. This is a time to recognize our country's past practices, which have scarred far too many generations of First Nations, Inuit, and Métis peoples. The flags at all city facilities continue to fly at half-mast following confirmation of more unmarked graves at former residential schools across the country. So tomorrow, let's celebrate what brings us together and reflect on how we can collectively work towards reconciliation. Encore merci beaucoup. Thank you very much.
Thank you, Mr. Mayor. As noted by the mayor, please note that he will be leaving early due to other commitments. Veuillez noter que le maire devra partir plus tôt en raison de d'autres engagements. We will now be hearing remarks from Councilor Keith Eglai.
Thank you, and thank you, Mr. Mayor, and good luck with your second shot later this afternoon. I want to thank everyone for joining us today. As of this morning, the City of Ottawa joined the rest of the province by moving into step 2 of the reopening plan. While gathering limits and retail capacity continue to increase, I believe so does the feeling of hope in our community towards brighter days ahead. Many of you may have those feelings as well, especially with the Canada Day weekend ahead of us and the plans many of you have of seeing loved ones. Ottawa Public Health would like to remind everyone that while we have come so far, especially with so many of you being vaccinated, to please continue to adhere to public health measures and to avoid the 3 C's: crowded places, closed spaces, and close contact. For those of you who have received your first COVID-19 vaccine, and for others who may now have received both doses, this is a reminder that public health measures continue to apply to everyone, including those of us who are vaccinated. So please, while enjoying this weekend's activities, continue practicing physical distancing, wearing a mask, hand washing, and please stay at home if you're feeling sick or unwell. The vaccines are effective at preventing symptomatic illness and death. However, public health experts still need to learn more about the protection that COVID-19 vaccines offer before changing public health recommendations. Speaking of Canada Day activities, with the recent events concerning residential schools in our country, OPH is asking the community to please take a moment on July 1st to remember and reflect on the lives and events that Indigenous peoples have been subjected to throughout Canada's current and past history. We would encourage everyone to please educate and inform themselves by accessing resources, including OPH's Reconciliation Plan, available on the OPH website and developed by OPH and local Aboriginal community partners. The goal of the plan is to put actions in place aimed at advancing reconciliation, and by taking a moment to review it, you might also be able to reflect on the ways that you can self-educate, improve your knowledge of Indigenous history, and be a better ally to Indigenous communities both here in Ottawa and elsewhere. Thank you for your time this afternoon. Merci and miigwech.
Thank you, Councillor Eglai. We will now be hearing from Dr. Etches.
Hello, bonjour, Kwe. As we continue to navigate our way through the COVID-19 pandemic, I do want to take a moment to acknowledge how the health of our community is determined by so much more than the status of a pandemic virus. I appreciate the work of the Indigenous health service providers that are currently supporting community members, the partners that are working with newcomers, people addressing mental health and substance use needs, employers getting people back to work, and the visitors in long-term care homes now returning in greater numbers and providing social support to our older adults. We all have a role to play in improving the health of our community, including by looking at root causes of health and ill health. And COVID-19 continues to be top of mind and critical to control to be able to have more supports for health in our community as we enter into step 2 of the provincial reopening plan. Step 2 means gatherings of up to 25 people are now permitted outdoors and indoors with up to 5 people. The table limit for patios is now 6 people, and personal care services are permitted. Businesses can increase their capacity. So while Ottawa is well positioned for this safe transition into step 2, I want to remind residents that we still need to keep measures like distancing and mask wearing in place in public settings As we know, the majority of our population does not yet have the 2 doses of COVID-19 vaccine needed to be considered fully vaccinated. So continue to choose lower risk activities by getting outdoors, play in a park, enjoy the city's multi-use pathways, a splash pad, a wading pool, or a public beach. Last week, the Public Health Agency of Canada released new guidance for vaccinated Canadians. And this guidance shows us that we can have a lot of confidence when we have 2 doses of the COVID vaccine. The work of maintaining masking and distancing when we're in close contact with people who may not be fully immunized, including children, it's appreciated and it's respectful as we continue to increase access to vaccine and second doses for all. We do expect further provincial guidance as the success of the reopening and keeping COVID-19 under control is evaluated. Même si nous passons à l'étape 2 aujourd'hui, nous devons maintenir certaines mesures comme la distanciation et le port du masque dans les lieux publics, car la majorité de notre population n'a pas encore les 2 doses de vaccin nécessaires pour être considérée complètement vaccinée. Porter un masque et garder les distances lorsque nous sommes en contact proche avec des personnes qui ne sont pas peut-être pas complètement immunisées, y compris les enfants, est à la fois apprécié et respectueux pendant que nous continuons à augmenter l'accès au vaccin et aux 2e doses pour tous. So once again, want to call on our younger adult population. If you're between the ages of 18 and 39, Ottawa residents have made so many sacrifices to keep COVID levels at a manageable level, and you are no exception. So I ask you to keep up the great work, and if you haven't done so already, to get your vaccine, the first dose and the second dose. It is your turn. C'est à votre tour. And I know for some, the process to book appointments has been confusing, it's been changing, it's been cumbersome. And for others, it feels like we're okay now, we're in the clear, but we aren't there yet. We need everyone to have 2 doses to be able to do their part to help us reach community immunity. So getting fully vaccinated as soon as possible will help move us into a place where we can get back to more things that we love. Indoor dining, larger social gatherings, going to the movies, theater performances, indoor sports leagues, karaoke, going to the gym, live music at your local pub, museums and art galleries, and no quarantine if you return from travel. Nous ne pouvons y arriver sans vous. Si vous ne l'avez pas déjà fait, prenez votre rendez-vous de vaccin dès aujourd'hui. Accélérez votre 2e dose. Faites-en votre été à 2 doses. We can't get to this place without you. If you haven't already, book your vaccine appointment today. And there's a reminder that all adults 18 and older are eligible to get a second dose sooner. So if you already have a second dose for a few months from now, Public Health is strongly recommending, I'm recommending that you register earlier. There are appointments available in the system. So make this your summer of 2 doses. If you have questions about the vaccines, please visit our website. There's a lot of good information there, or you can contact your health provider or call Ottawa Public Health to speak to a public health nurse, and we have a messaging system there as well with nurses. So lastly, if you're participating in Canada Day's activities tomorrow, please continue to follow the public health measures that are in place under Step 2 in the reopening plan so we can navigate our way out of this pandemic as safely as possible. Thank you. Merci. Miigwech.
Thank you very much, Dr. Etches. We will now be hearing remarks from Anthony DiMonte.
Good afternoon, bon après-midi. We continue to make exceptional progress in our efforts to offer COVID-19 vaccine to residents. With increased supply from the province, we have successfully increased our operations. We nearly doubled the number of community vaccine clinics and increased our capacity. Last week alone, we administered more than 108,000 doses. This is thanks to unprecedented collaboration between the City, Ottawa Public Health, and our community partners. Nous avons administré plus de 108 000 doses de vaccins la semaine dernière grâce à la collaboration sans précédent de la Ville, Santé publique Ottawa et nos partenaires communautaires. We are also setting new daily records for total doses delivered. Last Friday, Ottawa administered a record of 21,300 doses in a single day. This figure includes the incredible work of our local pharmacies and primary care teams, which continue to offer vaccine across the city. With these combined efforts, we have resulted in Ottawa achieving some significant milestones, with over 1 million total doses administered and 79% of adults having received at least one dose and 35% have received 2 doses. We are closer than ever before to protecting one another against COVID-19 and reopening our city. Today, Ontario entered Step 2 of the provincial roadmap to reopen. Step 2 of the roadmap focuses on resumption of more outdoor activities, and smaller but indoor activities and personal care services are also available. Aujourd'hui, l'Ontario entame la deuxième étape de son plan d'action pour le déconfinement de l'Ontario. Cette deuxième étape est axée sur la reprise d'autres activités extérieures, des petits rassemblements à l'intérieur et des services de soins personnels. I know many people are eager to gather with loved ones, enjoy more outdoor summer activities, and get a haircut or manicure. Our ability to do these things is possible thanks to our collective efforts to stay COVID-wise and get vaccinated. Our ability to enter Step 3 and fully reopen will depend on much of the same. As we head into Canada Day's long weekend, please continue to comply with the required public health measures. For those in line at a patio, please maintain a 2-meter physical distance from anyone outside your household or wear a mask. Limit your gatherings in parks and beaches, and remember that smoking, vaping, alcohol, and fireworks are strictly prohibited in parks. Lorsque vous faites la queue à une terrasse, veuillez maintenir une distance physique de 2 mètres entre vous et une autre personne qui ne fait pas partie de votre foyer ou portez un masque. Limitez vos rassemblements dans les parcs, sur les plages, et rappelez-vous qu'il est strictement interdit de fumer, vaporer ou de boire de l'alcool dans les lieux publics. Fireworks may only be discharged on Wednesday, Thursday, and Friday by someone 18 or older on a private property with permission from the property owner. As always, bylaw and regulatory services and Ottawa Police will monitor for compliance. Park ambassadors will also be deployed in some parks to provide information to residents. We need everyone to enjoy the weekend responsibly to protect our hard-fought progress against COVID-19. We also need to continue to get vaccines into arms. Our community clinics will remain open on July 1st and throughout the weekend. We run and operate 7 days a week. Nous voulons que vous profitez toute la fin de semaine de façon responsable afin de maintenir le progrès que nous avons fait dans cette lutte contre la COVID-19. Nous allons aussi continuer de vacciner la population. Nos cliniques communautaires demeureront ouvertes le 1er juillet et tout au long de la fin de semaine. As of Monday, all those 18 and older became eligible to book or rebook an accelerated second dose appointment. The recommended second dose interval for those who receive a first dose of mRNA is 28 days, whereas those who received AstraZeneca, the recommended second dose interval is 8 weeks. Vaccines are available at community clinics, local pharmacies, primary care teams, and through other targeted delivery channels, such as our ongoing pop-up clinics in priority neighborhoods. I'm pleased to advise that more than 120,000 bookings transactions were made on Monday alone for appointments in our community clinics. Appointments are still available in the provincial booking system through July 20th. Residents who have not already booked their first dose or accelerated their second dose are encouraged to do so. Lundi seulement, plus de 120 000 réservations ont été prises en vue d'obtenir un rendez-vous pour la vaccination dans nos cliniques communautaires. Des rendez-vous sont encore offerts jusqu'au 20 juillet dans le système de réservation en ligne de la province. On encourage les résidents qui n'ont pas encore obtenu un rendez-vous pour leur première dose de vaccin ou qui n'ont pas encore devancé le rendez-vous pour leur deuxième dose de le faire dès maintenant. Additionally, to help make it easier for Ottawa residents who would like to receive their first or second dose earlier than scheduled, an online wait list tool was launched last week that allows residents to access last-minute, same-day COVID-19 vaccines at our community clinics in Ottawa. All appointments become available, Ottawa Public Health contacts the residents by text, email, or phone. All appointments are for unclaimed doses that could become available at any time of the day. The tool resets at 11:59 p.m. daily, so interested residents should register after that time each day. As always, the best way to get the most accurate and up-to-date information about vaccine rollout in Ottawa is through ottawa.ca and ottawapublichealth.ca, or follow us on our social media channels. In closing, I would like to wish those that are celebrating Canada Day a safe and happy holiday. Merci beaucoup. Thank you.
Thank you very much, Mr. Dimonte. I will now invite questions from each agency alphabetically. You may ask one question and one follow-up. Nous allons maintenant répondre aux questions de chaque organisme par ordre alphabétique. Vous pouvez poser une question et une question de suivi. Again, a reminder to remain on mute until I invite you to ask your question. We will now start with Robin Miller at CBC Ottawa.
Hi there. This question is for Dr. Etches. You mentioned a call out there for younger people to get their second dose or rebook their second dose. I know that last week Renfrew County said that they were seeing a lag in that age group. Are you guys seeing a similar thing here in Ottawa?
Thank you. What we're seeing in terms of the coverage rates right now across different age groups in Ottawa is it's on our website. If people would like to look at it themselves, it's that the age groups between 18 and 39 have the lowest coverage rates right now. It's not the whole story in terms of where we'll end up. It's just a point in time. There are many people between 18 and 39 who are booked to have their vaccine in the future. And what we want people to know is the sooner the better, that this is a population that never really got a specific invitation. We dropped the age groups down 60, 50, 40, but we didn't say to this population, it's your turn. So I just want people to understand who might be thinking, oh, I'm not highest risk, I'm working from home, I can wait to have my second dose later. Well, the opportunity is here now, and it does make a difference. The sooner we can get to high rates of coverage, we're aiming for 90% coverage across every age group and every neighborhood. That is what will help us continue to go into the fall with COVID being kept at manageable levels.
Okay. And I also wanted to ask you as well about yesterday, Dr. Kieran Moore said that even though Ontario's met its targets for step 3 of reopening, he's suggesting that we should still wait 3 weeks to go into stage 3. And I'm just wondering what your thoughts are on that.
I can appreciate the question because when you look at the numbers of COVID levels and vaccination rates growing, it seems like everything's good. I think I can't speak for Dr. Kieran, but I know what he's looking at is probably what's underneath, what's happening with COVID variants. Are the variants growing, even though right now we see the overall level dropping? That's what got us in the spring. A new variant was rising with exponential growth. That took off even as other types of COVID were decreasing. So this is what the highest vaccination rates we can get will protect us against. It is a variant like the Delta variant growing. So the 3-week interval gives us time to grow the vaccination coverage, and it gives us time to see what is happening as people start to have more contacts with others. So we know reopening, it's just the way it works, more contact between people, more opportunity for COVID to spread. And so the time that it takes for us to see that impact, is going to be 2 to 3 weeks because of the delays, the incubation period, the testing that's required to see it.
Okay, thank you.
Thank you very much, Robin. Thank you, Dr. Etches. We will be moving on to Eric O'Brien at City News Ottawa.
Hi, good afternoon, everyone. My question is for Mr. Dimonte. We just seen the Toronto Health Unit set a single-day record for vaccines around 27,000 or so for the mass vaccination clinic that they set up at the Scotiabank Arena. Is that possibly something that we could see here in the city, even at the Canadian Tire Centre, for example? And logistically, what would that look like?
Yeah, I mean, it's something that I know that Toronto is having, and I spoke to my colleagues there. They had a bit more trouble, and I think the mayor's mentioned and Dr. Etches has mentioned. I have too. We don't seem to have the same hesitancy, which is great in this community, and all our bookings continue to fill up. That was a model that was used to encourage people, and there was You could get tickets to Leafs games or Raptor games. It was a way to attract, I think, like a marketing strategy, which I think was great. And they were able to, like you say, do 25,000 people in one day. As I mentioned, we're doing about 22,000 just in a day in our clinics. It's not something that we're currently contemplating because, to be honest, things are moving very, very well across all our system. And we're focusing still on our high-risk neighborhoods. We're able to get out to our rural communities as well too. So I think our current model is making us achieve all our goals. The old adage, don't mess with something that's working really well. So it's not something that we're really contemplating right now.
Now, just as my follow-up, I'm sorry, this might seem like a bit of an obvious question, but how are the city vaccination clinics running? Is it kind of the way you envisioned it? Because I know that, like you were saying earlier on in the news conference, that the ramp up has been super successful, even just in the last week.
So I don't think it's a bad question at all. It is, we envisioned as a team, we were looking and we were modeling this way back in December. What would the model look like? What could we do? How would we want these sites set up? All that's come to fruition. The processes that were put in place by the complete team, the public health nurses that are there, the support staff from the city, other partners have actually, it has been very successful. As you know, the ramp up was slow because we weren't getting vaccines, so we were able to bulletproof and test all the models and do all the little adjustments because there are tweaks that have to be done, the logistics and all that. So when we started seeing significant vaccine arrive, we were able to ramp up, as we'd said, and we've been saying since the beginning, give us the vaccine and we'll put them in arms, and we've got our sites open. And I'd be remiss not to mention too, because in parallel, the pharmacies have ramped up, and the physicians and the primary healthcare system has ramped up too. So it truly is a model that covers all across the board. And then we were able to, on top of that, focus in communities that had a bit more difficulty, the high-risk communities that had been identified early on by Dr. Etches and the public health team. We continue to go into those communities, and then our rural communities that had difficulty perhaps getting. So I think all in all, it's been successful, and it's what we envisioned, and things are working quite positively.
Thank you.
Thank you very much. We will now be going to Ted Raymond at CTV Ottawa.
Hi there, thanks for taking my question. My first one is for Mr. Diamante, just following up on what you have already said and the successes that you've had. We're still obviously trying to get to that 90% figure that Dr. Etches mentioned. How do you plan to do that moving forward, especially with accessibility issues, pop-up clinics, rural areas, getting those needles into the last groups of people who still need the first shot and the second shot? What are the plans to sort of ramp up even further? Or do you think that you can kind of basically just where we are now is good and we'll get there when we get there?
Yeah, it's a great question, Ted, and we're currently looking at that. Dr. Etches talked about, look, we're analyzing the data as it comes in, and her epi team, and through her leadership, we can identify certain groups that are perhaps a little slower. So, through social media channels, today's media availability, we're telling that 18 to 39 group, hey, it is your turn. There was perhaps a communications, less of a communication blitz for them. I think the current infrastructure that we have is sufficient to get us to the 90%. We've redone the rural communities. We're not going to stop, Ted. We're continually focusing on our high-risk communities. And I think there's going to be not challenges there, but there's important work that needs to continue to be done in those communities to get them up to those levels. And we're looking at them individually as well, too. But all in all, no, I would suggest that our current infrastructure that we have in place and the mobility that we have at the mobile side for the rurals, for the high-risk neighborhoods, will continue to serve us well to get us there. And like anything, I think we're going to see eventually not a plateau, but things slowing down, and that that last 5% will probably be our most difficult. But we're going to be when we get to that point, we're going to be putting all our resources, our energy, and I think directly to your point, it's going to be a lot lot about communications through all our media channels, through our social media, and trying to encourage people to get there. We're seeing the second doses increase well. We're now up to 35% second doses for the 18 and over. Some communities in this province were having trouble with the 12 to 17, but in Ottawa we're at 74%, very comparable. And you remember they started a little later and they were only permitted to use one type of vaccine. So I think we're when we look at all those all the data, things are all pointing in the right direction. So I think the infrastructure we have in place is going to get us all the way there.
Okay, excellent. And my second question, I suppose, is for Dr. Etches, just in terms of where we are now. We're moving into step 2, heading into step 3. Do you think that, you know, where Ottawa is in terms of COVID-19 and with the variants, we've seen a few cases of the Delta variant recently. Do you think we're leading the pack, leading the race to outpace Delta with our vaccinations? Do you think that is this going to be basically no more lockdowns after this? Mandatory masks, will that bylaw need to be renewed in the summer? Like, where are we in terms of COVID right now?
Thank you. And I'll probably just take the opportunity to underline Ottawa Public Health's commitment to support people who have not yet received a first dose to have that access. So the ongoing strategy with populations with lower coverage rates, we've taken a look, through the neighborhood discussions that happen, to understand what's going on, and people still have real barriers that we need to overcome around transportation or childcare. So this is the work is to understand what's the barrier now and keep lowering those barriers. So we'll keep working together on that. In terms of this race people have discussed between COVID and the vaccination, we're winning. We are winning. It's just that we're not at the end of the race yet. If we don't continue to have the vaccination ahead of the growth of the virus, we won't succeed in the end. We need to stay ahead and so that means, again, pushing the vaccination rate as high as we can. I think the current situation is positive. We don't have evidence of the spread of Delta in Ottawa, and we see the vaccination rates growing. It's just we need to stay on this track, and we need to really have that commitment across the whole population to reach 90% plus coverage levels. So right now, the wastewater shows us also very nicely how there's COVID in our community. It's there. We can detect it in the wastewater, but it's not rising exponentially. It's going up, it's coming down, it's going up, it's coming down. So, and it's not leading to hospitalizations. So that's what we're aiming for. We're aiming for a future where the vaccination rate is so high and people are immune so that when COVID is introduced, say by travel, like measles, we have widespread immunity to measles, and then it comes in by travel sometimes, it's contained. And we do the follow-up and it's contained. And most people, even if they're exposed, won't develop measles. So this is where we're aiming for. We need high levels of vaccination to do that. And right now we're winning, so let's just keep running.
Thank you very much. Next, we have Craig Lord at Global Ottawa.
Hi there. Sorry, this would be for Dr. Etches, I believe. We heard in recent weeks, it was Dr. Malakmi who said, we're likely underestimating the level of COVID in our community right now, looking at wastewater and low testing volumes specifically. So I'm wondering what should be the direction to residents right now around testing? Is it, going to get a PCR test at the slightest hint of a symptom? Should we be really trying to identify all cases, or is it a matter of self-screening? For example, just wondering if I can get your take on directions for residents right now on testing.
So testing is still very useful to find out where COVID is in our community, to better understand where it's being transmitted, what we can do to decrease the risk. It's very important as people go back to work environments where there could be risk of transmission between coworkers. So yes, the message is if you have symptoms that could be COVID, please go to one of the assessment centers. The wait, if there's no wait for testing, you can get a same day appointment and they can get you your result within a day. So, the turnaround time to wait for that result when you're supposed to stay home to find out if I'm negative or positive, it's almost the same day. So that, should be the practice. And when I say a symptom that could be COVID, and we are seeing, some mild symptoms are COVID. So headache, sore throat, even runny nose. If it's not something like, you always have allergies at this time of year, and it's your allergies or itchy eyes or such, but it really is still one of the tools we have to keep COVID at a manageable level. And I do encourage people to be tested if they have symptoms.
Thank you. For a quick follow-up, I think it'd be to Anthony DeMonte. Just wondering about the wait list that the city launched last week. What has the distribution been like for people on that wait list? How many people on average are getting actual appointments through this tool?
The pickup has been really good. I don't have exact numbers other than to tell you that I was at a site this morning, one of the pop-up sites that we set up, and the team there told me that they had processed a couple of hundred people. Sorry, no, it was at Canadian Tire Center. They had processed a couple of hundred people yesterday alone at one of the sites. So the pickup is really good, and I think it's a great method too if you want to move up. I think you can go on the provincial website and move from October from August to July, but this is even better. Like you can move up much quicker. So I would encourage people to use it. It's a great new tool. Initially, I know when you and your colleagues were asking us, we were using those doses at end of day for the rest of the healthcare workers and all that. But since we finished, this innovation, I think, is very positive, and it helps move people up for those second doses earlier. So I encourage people to use it.
Thank you.
Thank you, Craig, and thank you, Mr. DeMonte. Nous allons maintenant passer à Émilie Pelletier, le droit. Émilie, êtes-vous sur la ligne? Je vais vérifier. OK, Émilie, si vous avez des problèmes audio, s'il vous plaît, contactez l'équipe des relations médias, puis on peut repasser à vous plus tard. So moving on, we will be going to Blair Crawford at Ottawa Citizen.
Hi there. Just looking at the vaccination rates, we're seeing about 20% of the people who have not yet had their first dose, and I think over the months, with all the effort that's been put into getting targeted areas and communications, that they've had ample opportunity to do that. So I'm wondering how much of that are people who are vaccine hesitant, who don't want to get a vaccine, and what can be done to convince them to get their shot.
Mr. DeMonte, I'm happy to speak to this as well. That it's a partnership. We're both looking at these numbers and watching things. We know this isn't the end state. We know that people have booked appointments that will change this coverage rate. And still, if it seems uneven, if there's uneven coverage and there are populations with lower rates, we're exploring that and exploring why. So there are different reasons. I think that's where we need to have more of a tailored approach. So if it's transportation, then we need to bring the vaccines to where people are. If it's a lack of understanding that it's actually possible, there's vaccine supply now, I can move my vaccine date up or get a first vaccine easily, then that's also something we need to communicate in the right channels, in the right languages, to the right age groups, on the right platforms. So we are definitely working with partners to make sure that that message gets out. We know some people may have still safety questions about vaccines and they need information. So similarly, we need to make sure that people get their questions answered. And a good place to start is always Ottawa Public Health's website. So I think it's still possible to get the coverage rates up to where we want to see them in the end. And it does take some work to make sure that we're understanding, the barriers that people face.
Yeah, sorry, I would also add to Dr. Etch's comment. I think all that is extremely important. We've got to continue looking at, but she mentioned it earlier, and I want to repeat it. The book isn't quite written yet for July. We've got 200,000 booked appointments from July 1st to July 20th. So I think once we see that start flowing through the system, we'll see a lot of these numbers adjust, both for first, second doses, and even for the group that we've been talking about today, 18 to 39. So those numbers have to flow in, and those people have to come to their appointments for us to get a better understanding. And we're monitoring that on a daily basis to see what those trends are. And I think, midway through July, we're going to get a better understanding. To your good question about, do we have a challenge here? Is there a problem or not? Now it's going to start filling in. It just depends on who those 200,000 people are.
And as a follow-up question, I think this was in Toronto earlier this week, where there's a vaccination clinic, and when they announced that they'd run out of Pfizer vaccine and there was only Moderna left, a bunch of people bailed out. Have you seen any thing like that in Ottawa, reluctance to or choices between the two vaccines?
We have seen a few people turn around for twofold. First, most of our clinics now have both Moderna and Pfizer available. As you know, as we speak, and that may be changing in the next 24 hours, but as we speak, Pfizer is the product that's available for the 12 to 18. So we know who's coming for the day, who's booked, who's coming. So we ensure every day that Pfizer's put aside for those 12 to 18, whatever's left over. Our objective is always to give the individual the same product that they got for their first dose. So when you arrive, if you had a Pfizer, we're going to offer you Pfizer if it's available. Only if it's not available are you then, and that discussion takes place with the clinician that's there, offered the other mRNA, which is equivalent and is transferable, but you make that informed consent. So broadly, the process is in place, and it looks like for the next while, from what we're hearing from the province, we'll start seeing that flow of both Pfizer and Moderna available to us. So I think we're going to continue the model where we have it both available in all the clinics. So that said, I think that's pretty positive. We have seen some hesitancy, and there have been cases where people have turned around, which is very unfortunate. And so we want to ensure that stops, but it has been very, very few cases overall. And I think now that the information out there, people are realizing that it's the right thing to do. So take the mRNA that's offered to you, but we're attempting to ensure that you get the one that you had previously.
Thank you very much. Nous allons maintenant passer à Frédéric Pépin à Radio-Canada.
Merci de prendre ma question. La première question pour Madame Etches. Madame Etches, est-ce qu'on pourrait vous entendre sur, justement, vous l'avez mentionné en anglais, là, mais la phase 3. Là, on est à la phase 2, mais certains disent qu'avec les taux de vaccination, on pourrait déjà passer à la phase 3. Est-ce qu'on devrait devancer cette phase 3-là, selon vous?
Je comprends la question parce que nous avons eu le progrès avec la vaccination et la diminution dans le niveau de COVID-19. Mais aussi, avec chaque étape, il y a la possibilité pour une augmentation dans la transmission de COVID-19 parce qu'il y a plus de contacts entre eux. Et ça prend temps de voir l'impact. Et c'est possible que le variant Delta augmente quand les autres types de COVID diminuent. Alors, c'est quelque chose qu'on regarde et c'est vraiment important d'avoir un niveau de vaccination plus haut que possible. Et c'est important de prendre le temps d'augmenter cette protection aussi, d'arriver à un point où on peut gérer le niveau de COVID, même si les variants Delta. Mais nous ne sommes pas là maintenant parce que ça prend 2 doses d'avoir la protection nécessaire.
Merci, Mme Etches. Ma deuxième question serait pour vous, M. Dimonti. Qu'est-ce que vous dites aux gens qui s'apprêtent à venir marcher ou manifester ou se rassembler demain sur la colline du Parlement? Il y a des marches qui sont organisées, qui devraient partir de Gatineau jusqu'à la colline du Parlement. On s'attend probablement à beaucoup de monde. M. Dimonti, côté sécurité, côté COVID, mais aussi côté droit de manifester, vous, c'est quoi le message que vous envoyez à la population et est-ce qu'on les aura à l'œil?
Tout d'abord, ça devient la responsabilité des services de police, donc pas nécessairement ma responsabilité. Néanmoins, ça devient problématique au niveau de 2 côtés. Premièrement, au niveau de santé publique. Les gens, s'ils ne respectent pas, s'ils ne portent pas des masques, s'ils ne respectent pas des distances, c'est des événements qui peuvent créer des problèmes au niveau santé publique. Donc, les gens ont le droit de manifester, puis ça, c'est le deuxième élément. Notre droit de manifestation en termes constitutionnels est sacro-saint. Donc, ils ont le droit de manifester. On ne les arrêtera pas de manifester ou la police ne les arrêtera pas à moins que des problèmes quelconques d'ordre criminel. On doit arrêter des choses. Mais si les gens viennent manifester, au moins, je veux les encourager de... S'il vous plaît, suivez les recommandations de santé publique. Portez un masque, restez une distance, faites votre manifestation, mais ayez en tête qu'une manifestation de ce type-là est un environnement qui peut créer des problèmes et on peut regresser et la COVID peut se transmettre si les gens ne respectent pas l'ordonnance de santé publique. Donc, peut-être cette première responsabilité. Et la deuxième, ils ont le droit de manifester. C'est un droit constitutionnel qui est garanti à tout citoyen. Et la police va tout simplement assurer que ça se fait sans avoir de problématiques.
Merci beaucoup. Finalement, pour clore, nous allons aller à Catherine Fortin à TVA Gatineau, Ottawa.
Bonjour, ma question est pour Vera Etches. En fait, c'est concernant le variant Delta. Il y a eu une hausse en Ontario, à Ottawa dans les derniers jours. Est-ce qu'on a des inquiétudes face à ça?
À ce point, à Ottawa, nous n'avons pas évidence qu'il y a une augmentation avec le Delta ici, mais ça prend temps d'avoir les résultats de dépistage. Alors, la tendance partout la province, c'est que c'est possible d'avoir l'augmentation où la pandémie peut augmenter encore. C'est pourquoi on a besoin de procéder avec précaution. C'est pourquoi on a vraiment la priorité de 2 doses pour tout le monde. Mais à ce moment, je pense que on continue, on est avant le virus et j'espère qu'on peut utiliser les mesures. On a les outils de la distanciation, les masques. Maintenant, pendant on continue avec la vaccination de convaincre ce virus.
Merci.
Vous n'avez pas de questions de suivi, Catherine?
Non.
OK, merci beaucoup. Oh, sorry. Finally, we will go to Pat Goccioni at Your Community Voice. Pat, are you on the line?
I am. Mike, I guess my question would be for Councilor Eglai in the mayor's absence. Just wondering if there's been any discussion yet at the political or administrative level about the return to work for city employees, with the vaccination campaign going so well and, hopes of a 2-dose summer, whether there's been any discussion at all about that.
So, I mean, there's always discussions around things like that. Dr. Etches might be able to weigh in because she'll be providing advice to the city manager's office. But my understanding at this point is no firm decision has been made as to when the return to work at City Hall will happen. But I'll turn that over to Dr. Etches if she has some inside information I'm unaware of.
Sorry, before we go to Dr. Etches, if I may, Pat, I do have some contacts on behalf of the city that I could provide as well. So go ahead, Dr. Etches.
Yes, I don't have any inside information about the city. What I can share is, that when people have 2 doses of vaccine, we can have confidence that that's good protection against transmission of the virus. And so what we'd like all employers to do, the city as well as others, is really focus on promoting vaccine, make it easy for employees and workers to be immunized, to follow up and get that second dose. That is what will make it much safer for people to return to the office. And we do expect provincial guidance. I think we'll be following the provincial direction around when it then becomes time to be able to operate in environments without the masks or without the distancing. We're not quite there yet, but we do see this summer is going to make a difference. The massive undertaking, thanks to Mr. DeMonte and so many working on the immunization campaign, it will make a difference for workplaces in the fall. And so that's really what we're looking forward to.
Great. And a second question is around the vaccinations. There has been a push to accelerate appointments for 18 plus. Do you know when or if that will happen for the 12 to 18 age group?
The 12 to 18 age group are eligible, and that group has been, when we look at the numbers, has been moving quite well. As I mentioned earlier, I'm just looking for my data right now. They are not as high as the general population, but they're quite there. If I believe it was 74%. So they're moving through the system well, and we don't have any current worries that there's a challenge in that age group right now, Pat.
And I think the question is, when will they be eligible for their second dose to come maybe sooner than it was originally booked. That is a provincial policy that we're waiting to hear what the province will say about when the timing of that second dose should occur. I believe right now it's about 56 days after the first dose, and there was the intention to try to have children and youth 12 to 17 have 2 doses before the return to school. So I think that's still what we're operating under. And as has been the pleasant surprise all along, we may have the capacity to move that up.
If I could ask a very quick question on that same vein, is there any word about vaccines coming for children under 12?
Did you say, is there any worry? That would
no,
be good.
Is there a vaccine? Have you heard any word about a vaccine coming for children under 12?
We know there are trials underway for children 5 to 11 and even under 5. And so we expect that first age group, the study results in the fall. And then it would be about the companies are, working with the regulatory authorities, they go through the same process for approval.
Great, thanks.
Thank you very much, everyone. This concludes our media avail for today. Ceci conclut notre point de presse pour aujourd'hui. Have a great day. Bonne journée.